Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Vesicoureteric reflux. So vesicoureteric reflux is nothing but, it is also known as a VUR, vesicoureteric reflux. So this is nothing but its autosomal dominant, that is AD, and it is the most common congenital. It is a congenital abnormality. So the congenital abnormality. And this is of the urogenital tract, and it is the most common in case of the children, and it is often asymptomatic. It is spontaneous resolution due to the maturation of the trigone as well as the bladder. The causes is it can be primary and secondary. Primary is the short intravascular length of ureter, and deficiency of the longitudinal muscles over the urethral orifice, over the ureteric surface. Next is secondary. Under secondary in children, if you see, it is a posterior urethral valves. And there is also in adults, there is a neurogenic bladder, which is seen. Then looking at the investigations, there is investigation of choice of diagnosis. It includes the MCU. So this is the MCU, that's a mixed-rating cystourethrogram. The international classification of the VUR, it's based on MCU. So grade 1 means there is a reflex into the non-dilated ureter. Grade 2 is a reflex into the pelvicalcial system. So 1 means reflex into the non-dilated ureter. So dilated ureter, non-dilated ureter. Reflex into the pericalcial system. Then comes grade 3. Grade 3 means it is mild to moderate. Grade 3 is mild to moderate dilation, and this is of the ureter. And this is with the reflux into the pelvicalcial system. So one is the reflex into the non-dilated bladder, ureter, and then comes the reflex in the pelvicalcial system, and mild moderation dilation of ureter with the reflex into the pelvicalcial system. Then comes the grade 4. So grade 4 means there is blunting of the fornix, and this is with the reflex into the pelvicalcial system. Next is the grade 5. The grade 5 means there is a dilated and tortuous ureter, dilated and the tortuous ureter. So this is with the reflex into the pelvicalcial system. So reflex into the pelvicalcial system. Management of this will be by the prophylactic antibiotics for all patients, regardless of the VUR grade, to prevent the UTIs. Then you give the antibiotics, ampicillin as well as amoxicillin. This is for the children up to the 6 weeks. Then comes the TMP as well as the SMX. So SMX is for the older children. And then comes the medical management. So medical management, if you see, is adequate for the grade 1 to 3, and unilateral grade 4 VUR. Now what about the surgical innovation? The surgical innovation for the bilateral grade 4. This includes then the grade 5, so G4, G5 as well as the recurrent UTIs. Now the older children, it also includes the older children, and the permanent scar. There's permanent scar as well as a bladder diverticulum. Now what are the surgical innovations? Surgical innovations, it includes a ureteroplasty, that is the strengthening of the uretrovesical junction, Then comes the sting operation. Sting operation is a subureteric transurethral injection, transurethral junction. Then comes the sting operation. The sting operation, it stands for the subureteric transurethral junction in the Teflon paste, then the ureteric reimplantation. This is the Lich-Grigor technique is preferred. This is preferred. To learn and grow daily like this, please do subscribe.